Here.
Senator Bratton, Senator Hudson, Senator Nicola, Senator Nirenberg, Senator Lewis.
Here.
Quorum is established.
Thank you. Quorum being established now, Senator. I was just in a hurry for you, so
Oh,
go
thank
ahead.
you very much.
Begin when
Thank
you're
you
ready.
for rushing this bill. It's a top priority of mine. For the record, the State Senator Nick Schroer from St. Charles County, presenting Senate Bill 887, the Missouri Lyme Disease Eradication Act. Again, I want to thank you all for fast-tracking this. It's a bill that has impacted not only my family, but many in this room. And I want to thank the many people who are here to testify and those who have shared their stories. And I put a packet on your desks for you that kind of goes a little bit through this bill, makes it a little bit more simplistic for you. It's a difficult issue to grasp as these tick-borne illnesses go out and cover other areas outside of just Lyme disease. While Lyme disease has historically been more prevalent in the Northeast and upper Midwest, data has demonstrated that tick-borne illnesses remain a significant and growing concern nationally. According to the CDC, nearly 100,000 Lyme disease cases were reported to health departments in 2023, which is widely understood to underestimate the true burden that this has, with an estimated 500,000 people diagnosed and treated for Lyme disease each year across the United States. As I was explaining to one of the senators earlier, in Missouri, we are regularly seeing patients receiving false negatives by using outdated and limited tests to diagnose Lyme, thus going many years without receiving actual treatment due to these faulty tests. Nationally reported Lyme disease rates are reaching approximately 27 cases per 100,000 people in 2023, which was the highest level recorded under the current reporting system. While Missouri does not traditionally rank among the highest in confirmed Lyme reports, tick surveillance data shows that multiple tick species carrying Lyme and other pathogens are well established throughout the state, and surveillance efforts have identified infection rates in ticks collected here. Senate Bill 887 is designed to improve reporting, enhance education, and support eradication efforts by ensuring that Lyme and other tick-borne illnesses are fully integrated into Missouri's disease prevention and control infrastructure. It will empower the Department of Health and Senior Services as well as research institutions with better tools and data to combat and protect Missourians from these tick-borne illnesses. It was just a couple years ago, my wife, who is a healthcare practitioner in St. Charles County, went through a grueling effort to try and figure out what was causing her health issues. Many of thousands of dollars later, we found out that she had Lyme disease. And it was Dr. Charles Christ, who is here locally, who she had worked with to get this diagnosis and was a mentor to her as she is now treating people with Lyme disease. Dr. Christ just passed away, I think it was last week, of a heart attack. And many of his patients who received care know how difficult it was in a journey to just get to him. That led me to last year, after receiving some health issues of my own, getting diagnosed with Lyme disease, and the treatment continues. So, again, this is a first effort at trying to provide these tools to the state of Missouri to get this information out there, whether it's for people's safety of knowing more about Lyme disease, knowing where to go, where not to go, how to eradicate these things, and for the treatment facilities like University of Missouri and all of the other collegiate institutions here, that they can start researching this and collaborating with the government to try and provide some answers and treatments for our constituents. So with that, I would like to open it up for any questions, and we have a expert witness here, Jennifer Russell, who is dealing with this in Illinois, and she can share her story, and her children are here as well.
All right. Appreciate your testimony and your passion for this issue. Are there any questions for the senator? All right. We'll begin with the first testimony of our first witness. Oh, I'm sorry. Thank you.
Good morning.
Good morning.
I had to check to see if it's still morning. Thank you for sharing your personal story and your wife, and sorry that you lost your physician friend recently. I love the spirit of the bill. Just a few little nuances.
Mm-hmm.
Just wanted to ask. I think you said this is your first pass at it.
Yes.
Okay. So on page 5, section 192.028, just a little concern why we're like wouldn't. Can you explain that to me?
Yeah, and I think you're going to hear some testimony today that in other states, and there are some physicians in corporate healthcare in the state of Missouri, that are either being told that they can't treat Lyme disease with certain protocols, even though they're using their expertise that they've received at medical school and different clinicals and teaming with people like Dr. Christ. I don't want to say they're being bullied, but in other states we have seen where they've been disciplined by treating Lyme disease in non-traditional ways, using their medical expertise. It's something that traditionally, I want to say back maybe even 10 years ago, my own physician said, no, this is a conspiracy theory. Lyme doesn't exist. And now I don't care what side of the aisle you're on. It's really cool to see the administration now, President Trump's administration, working with RFK and hearing stories from people who felt voiceless for so many years. But a lot of these doctors are coming forward saying, okay, if you allow me to treat and how I know this is the best way in each individual case, then that'll be fine. So give me some cover and allow me to treat my patients. And I don't want to say, there was a bill that we passed several years ago, the Right to Try bill. It's similar to that, that what's best for you might not be best for me in treating these types of tick-borne illnesses. But I'm happy to work with you in trying to put some parameters around there so we're not allowing for quacks to get rich off of giving sugar pills to treat Lyme.
Yeah, that sounds good. Thank you.
Yep. Follow up on that. That's what I would like to see right now. We've got to have some limitations here. I think, again, medically necessary. That gets, yeah, there's probably some work to be done on that.
Yeah.
That section. And so I don't know if there's going to be folks here that are going to be here to testify in opposition, but I'm sure there's some tightening of language we could certainly do on that.
Absolutely. And I know some of the
area.
groups.
And as Senator Lewis says, same thing. I really appreciate the spirit of the bill. There are, as we were talking about, it seems like just more and more we're seeing so many of these cases. And I appreciate you bringing this to the forefront. And hopefully we can do a little bit more to bring folks across Missouri some relief. So
Absolutely. Yeah, I'm happy to work with anybody. I know a couple groups that have dealt with this in other states. I've recommended some changes. So I promise you this will not be the final language that we're going to see on the floor. It's probably going to change, have several different iterations as we get different experts coming in saying, hey, we tried this and this is what works. That's the goal. We're from the Show Me State. We've seen how other states, including our friends in Illinois, have been able to address this. So let's replicate their success.
Senator, just one question. Is there other language that you mentioned Illinois? Do you know of other states that have passed similar language or?
Offhand, there's a hodgepodge of different states that have addressed whether it's reporting requirements, data collection, compiling, like Illinois has a website geared to monitoring where some of these cases are. And that's kind of where I got the idea of taking all of these little approaches and trying to put it in this one big Hail Mary to help our constituents.
Okay, sure, appreciate it. How many here are here to testify in favor of the bill? All right, any in opposition? Okay, thank you. All right, you can begin with your first witness here to testify in favor. Let's just say there wasn't too many. Begin when you're ready.
Thank you. All right, good morning, everyone. Thank you so much for giving me the opportunity to speak today. My name is Lauren Russell. I'm the Advocacy Director for the Illinois Lyme Association. I'm honored to be here, not just as an advocate, but as a patient who's been deeply shaped by Lyme disease. It's such a dream to be here, considering I am a Mizzou Tiger, and I have spent my high school years riding Time Traveler down in Branson, so Missouri definitely has a special place in my heart. So I want to start off by saying this. Lyme disease is not rare. It's real. It's not just a northeastern problem. It's in the Midwest, and it is here in Missouri. And it's affecting more families than I think most people realize. So for me, Lyme disease is very personal. It shaped my childhood and the person I've also become. When I was 7 years old, I came home from school one day, and I couldn't even make it to the house. My legs just stopped working from exhaustion. And I collapsed in the driveway until my mom eventually came out and found me. From then on, my health began to decline. I developed symptoms that no child should ever have to endure, from extreme fatigue, constant pain, neurological issues, fevers, and eventually even memory loss. I spent much of my life in bed, and teachers eventually had to come up to my house to tutor me. My life became a cycle of doctor visits, tests, and more tests, always resulting in unanswered questions. So to give you about an idea, my medical file is about 5 inches thick. I was diagnosed with everything imaginable, from just a simple common cold, chronic fatigue syndrome, hypermobility, and there was eventually at one point doctors thought I may even have leukemia. No one could explain to me why my body was failing me. I was sick, I didn't look sick, and it made it easier for my suffering just to be dismissed. It took 3 years to finally get answers, and 3 years of being misunderstood and watching my childhood simply just slip away. Eventually, we found a doctor who did believe in me and who knew the test to order and who trusted her clinical judgment. Those tests came back positive for Lyme disease, but by then it was already considered late stage. I went through 4 years of treatment and fighting to get my life back, and I'm grateful to say I stand here at 20 years old and to say that I'm doing well. It hasn't been easy, and Lyme disease is not something that simply just disappears, but it gives me a perspective most people my age never have to develop. It taught me how important community and access to proper medical care truly are. After my treatment, my mom and I went to our capital in Springfield, Illinois to advocate for change, and together we helped pass legislation that transformed Lyme care in Illinois. The Lauren Russell Lyme Disease Prevention and Protection Law allows doctors to treat outside CDC guidelines without fear of losing their medical license. Illinois is now one of the few states that also offers insurance coverage for state-regulated plans. Those laws passed unanimously with complete bipartisan support because Illinois lawmakers understood this one simple truth, that patients deserve access to care and doctors deserve the freedom to practice medicine based on their own clinical judgment. So that's why I'm here in Missouri today. Lyme disease is not just 10 days of antibiotics and then you're done. It can be very complex, and it affects your brain, heart, joints, immune system, and even your mental health. It can look very different in every patient, and when treatment is either delayed or restricted, Lyme becomes harder, expensive, and more devastating to have to manage. In 2023 alone, nearly 890,000 cases were then reported to the CDC, and we are quickly approaching 1 million people. This is not rare. This is now becoming a public health crisis. Organizations like the Illinois Lyme Association exist because too many patients are too sick to advocate for themselves. So my mom and I started it when I began to get better because no one else should have to suffer in silence the way that I did. This legislation that you are considering today does exactly that. It protects doctors who treat complex cases, and it gives patients access to care. It allows medicine to be guided by judgment and not fear, and it gives children, and it prevents children from becoming chronically ill adults. Had these protections existed early in my life, my story might have been significantly different. I might not have lost years to a misdiagnosis, and I might not have developed late-stage Lyme disease, and I might not carry the lifelong risks that come with this delayed treatment. But because Illinois acted, my story did change, and Missouri also has the same opportunity to change thousands more. No one should have to become chronically ill before someone takes them seriously, and no doctor should fear helping a patient who desperately needs their help. Patients shouldn't have to cash out retirements or even take out a second mortgage just to pay for their care. So thank you everyone for listening to my story, and we ask your support in passing Senate Bill 887.
Thank you, Lauren, for coming and sharing your story and sharing your testimony. Are there any questions for the witness? Go ahead, Senator.
Good morning.
Morning.
Thanks for being here and being involved in Illinois and then coming to Missouri. That's pretty awesome,
Thank
pretty
you.
impressive.
Thank you.
I just had a question. As I look through this bill, it's all about like the treatment. Did you guys do anything about prevention in Illinois? You know, like how do we get ahead of this? Is there any bills that, any laws that you did in Illinois to address prevention?
With the Lauren Russell Lyme Disease Prevention and Protection Law, it allows doctors to treat outside CDC guidelines. It did set up a task force also in Illinois to help us kind of work with that. And then later we did come back in 2019, I believe, for insurance coverage for Lyme patients.
Okay, and I'm like thinking, and I can work with the senator on like how we get ahead of it. Like how can we, you know, like you said, it's a real problem. It's not rare anymore. So, you know, what do we need to do more deer hunting or something? You know, like whatever. But
Yeah.
anyway, just curious on what you were doing for prevention. Thank you.
Thank you.
Any other questions for the witness? Seeing none, thank you for your testimony
Thank
again.
you.
Make sure you fill out witness forms also. Appreciate it. Leave them there on the desk. All right, next. Testimony in favor?
Good morning, Chairwoman Carter and committee members. Thank you for allowing me to speak today in support of Senate Bill 887, the Missouri Lyme Disease Eradication Act. My name is Jennifer Russell. I'm the founder and executive director of the Illinois Lyme Association. I am truly honored to be asked to speak to you today. As my daughter Lauren shared, she is currently a student at Mizzou, and my younger daughter here, Larissa, will be starting there this fall. So as Lauren said, we frequently vacation in Branson, so Missouri is very much a part of our family. So we live in a small rural community outside of the Quad Cities in Illinois. In addition to Lauren, 2 other family members in my household have also been diagnosed with Lyme disease. So this is not just professional work for me, it is deeply personal. Lyme disease has profoundly impacted my family. It has been a long, difficult road, but after Lauren's recovery in 2018, we saw a tremendous need to help others navigate this journey, and that is why we founded the Illinois Lyme Association. So tick-borne illnesses are now the fastest growing infectious disease in the United States, having doubled over the last decade. Lyme disease alone occurs 1.5 times more often than breast cancer and 6 times more common than HIV. So the CDC estimates reported cases are underreported by a factor of 10. And as Lauren mentioned, we are approaching nearly 1 million cases each year. That number is staggering, and it carries devastating consequences. Many patients can no longer work, families cash out their retirements and take out second mortgages on their homes, all because diagnoses are too often delayed, testing is inadequate, symptoms are overlooked, and treatment guidelines fail to address the full complexities of these infections. The impact goes far beyond physical illness. Patients experience cognitive impairment, extreme fatigue, anxiety, depression, and in some cases, suicide. This is not just a medical crisis, it is a public health, economic, and mental health crisis. Oops, sorry. And new threats continue to emerge. The alpha-gal syndrome and anaphylactic allergy to mammal meat and mammal byproducts is now very common in both Illinois and Missouri. The Asian longhorn tick has arrived in Illinois and continues to spread. The ticks do not need a mate to reproduce, and they lay about 2,000 eggs. It causes the livestock to become severely anemic and can result in death, posing a serious risk to our agriculture industries. Tick-borne diseases is no longer an East Coast issue. It is here, and it is knocking on our doors. In Illinois, we began a grassroots volunteer effort that has now grown into a statewide public-private partnership. So through collaboration with our Department of Natural Resources, Department of Public Health, the University of Illinois, and our medical societies, we have built a coordinated education, surveillance, research, and provider training efforts without placing a significant burden on the state. So with strong bipartisan legislative support, the Lauren Russell Lyme Disease Prevention and Protection Law enabled Illinois to establish comprehensive tick surveillance, protect physicians' ability to treat patients outside of the rigid CDC guidelines, create a dedicated task force within the Department of Public Health, secure insurance coverage under state-regulated plans. These patient-centered policies have proven both effective and cost-efficient. So just recently, the Department of Health and Human Services hosted a national roundtable on the impact of Lyme disease and tick-borne disease and discussed new commitments and opportunities. I am hopeful that more accurate testing is coming, hopeful that new treatment research will follow, but federal progress alone is not enough. Every state needs to address Lyme and tick-borne diseases at a local level. So that is why Senate Bill 887 is so important. It gives Missouri the same opportunity that Illinois had to act early, to build prevention systems, to protect patients, and to support physicians. Both of our states are still ahead of the curve, but what the East Coast is experiencing today will soon be our reality if we do nothing. We will no longer be able to go outside without having multiple tick encounters. So now is the time to put prevention and response systems in place before the burdens become unmanageable. I am more than willing to help Missouri in any way as I can to help you build a sustainable approach in addressing tick-borne disease. I would also like to give a special shout out to our legislative champions in the Illinois House of Representatives who are listening to our hearing this morning. So your leadership matters more than you know. Thank you, and I am happy to answer any questions. I also did bring, as the senator had a question about education, this is one of our huge projects that we worked on with the Department of Public Health and the Department of Natural Resources. There are trail signs and park posters going through prevention information for our communities, and they go up in the state parks and community parks around the state.
Very nice. Thank you, Jennifer, for coming and spending your time to come over to Missouri, and we're always happy to have you. As a mom who advocated for many years for my son who had a disability, it warms my heart to see moms who are engaging for the benefit of their children. So again, thank you so much for your passion, your work, and especially to see it's because of your children. So thank you. Any questions for the witness? Seeing none? All right. Thank you. Next, testimony in favor of House Senate Bill H 87.
Yeah, they got some over here.
Begin when you're ready. Make sure also, just housekeeping, make sure you fill out a witness form if you haven't. And
Oh,
leave it
yes.
on the table.
Hi there. First, I'd like to thank you all for the opportunity to be here today to speak to you regarding this Senate bill. I want to personally thank the senator who is sponsoring this bill, and these are very important, long overdue conversations and discussions that we need to be having here in Jefferson City. This is a major public health threat here in our state. My name is Melinda Sander. I'm a resident of Moberly, Missouri, up in Randolph County. My husband Chris is here with me today. He's the athletic director at West Rand School District in Huntsville, Missouri. We have 3 children, and I'm a 12-year tick-borne illness survivor. I cannot adequately put into words the profound effect these infections have had on my health, physically and mentally, in addition to the lives of my husband and my children and other family members. I was bitten by a tick carrying Lyme disease, Bartonella, Babesia, Rocky Mountain spotted fever, and ehrlichiosis in the fall of 2014 in my dad's backyard at Sugar Creek Lake in Randolph County. I didn't develop the well-known bullseye rash that many chronic Lyme survivors across the U.S. will tell you that they didn't develop that either. I went 2 years, my health just slowly unraveled. I saw over 25 physicians spanning 8 specialties, and I received at least 10 misdiagnoses. I had physicians express concerns of ALS, MS, early onset Alzheimer's at the age of 37, depression, anxiety, focal seizures. I developed multiple food allergies, lesions on my brain. There was not a system in my body that was not affected. I developed neurological, cardiac, GI, visual, spatial, digestive, hormonal, multiple autoimmune conditions, mold toxicity, and neuropsychiatric issues. I had major memory loss, difficulty reading, writing, concentrating, autonomic nervous system dysregulation. I became allergic to most foods, uncontrollable blood pressure and heart rate fluctuations, severe panic attacks that would last hours, debilitating muscle fatigue. I would become severely short of breath just climbing a flight of stairs, and painful neuropathy. I developed episodes of sleep paralysis and feelings of patches of my skin being on fire. To say that I was fighting for my life is very true, but I was also fighting long enough for doctors to believe me. Because the majority of diagnostic tests that came back were normal, all of my imaging with the exception of my brain imaging, which did show lesions, I was crying out for help. I also was raising 3 young children at home. I had physician after physician tell me, but you look normal and it's all in your head. I had multiple physicians in our state tell me that Lyme disease does not exist in Missouri, including physicians at University Hospital Systems and Barnes-Jewish in St. Louis. In fall of 2016, I traveled to Mayo Clinic in Rochester, where I was also told tick-borne illness and Lyme does not exist in the state of Missouri, and then I needed a psychiatric evaluation. Along the way, I lost my career. I was bedbound for months at a time. I've been hospitalized multiple times with complications. My husband and I have had to sell our family home. We've spent well over $250,000 treating these infections just to beat them back enough so that I can stand upright today. Most of the treatments I do are considered alternative therapies because the current CDC standards of care are adopted by the IDSA, which is the Infectious Disease Society of America, and they are only adequate for individuals with acute infection, not a chronic disease state. I would actually consider myself one of the lucky ones because in the beginning my symptoms were so severe that I had no other choice but to keep fighting to figure it out. But I will say that Lyme disease affects every single individual differently. I'm also an alpha-gal patient. Alpha-gal showed up after the first time that I had the COVID virus. My doctors think that it was maybe somewhere there in a dormant state and that the virus just reactivated it. And I can tell you that it's a special kind of hell living in the state of Missouri and being allergic to beef and pork and anything mammal-based. When I was at my worst, I laid in my bed and I emailed state and national senators and representatives sharing my journey. One day, I received a phone call from Senator Roy Blunt's office inviting me to come to Washington, D.C. and share my story with members of Congress on the HELP Committee, which is the Health, Education, Labor, and Pension Committee. It was at that point that I got involved with federal advocacy efforts for the Center for Lyme Action. I've returned to school to finish my master's degree in public health, and I currently serve as the Community Engagement Fellow for Center for Lyme Action in Washington, D.C. We work in D.C. with members of Congress to advance health policy surrounding tick-borne illness. We host informational series several times a year, and I help coordinate state-level team efforts for our virtual advocacy day, which includes over 10,000 advocates nationwide. I'm also an ambassador for ILADS, which is the International Lyme and Associated Disease Society, and that's a medical society whose sole purpose is dedicated to diagnosis and appropriate treatment of Lyme and associated diseases. I'm glad that Jen and Lauren mentioned the Department of Health and Human Services roundtable discussion, which took place last month in DC. Our community is very hopeful after this event. For the first time in history, it was acknowledged by our top governing officials that these infections have been widely ignored and underfunded and under-researched, and we now have a major public health crisis on our hands. Current diagnostic testing is faulty. There's a LymeX Innovation Accelerator that's housed within HHS, and it focuses on improving diagnostics, but we have a long way to go with that. Treatment for chronic infection is ever evolving, but it also has a long way to go, and there are a lot of things at the federal level that we really need to prioritize. I will close with saying that our state is home to a huge farming and hunting population, as well as outdoor recreation-loving residents. Every Missourian is at risk for these diseases if they go outside. I have mentored, through my advocacy work, many generational farm families in Missouri whose lives have been completely altered by Lyme, other tick-borne illnesses, and alpha-gal syndrome. Awareness is key, I think. In May of 2025, I met with Senator Eric Schmidt in D.C., and when I told him that Missourians are becoming allergic to beef and pork, he looked at me like he didn't believe me. So awareness is key here. We need to make sure that our elected officials know what's going on in their state on the ground. I know firsthand how debilitating these illnesses can be and how many people, especially Missourians, are suffering without a timely diagnosis or appropriate care. So these conversations are long overdue, and I truly appreciate your leadership and willingness to engage in these conversations.
All right. Thank you, Melinda, for coming. Where's your husband?
Right over there.
Chris, raise your hand. Awesome. Thank you for supporting your wife and being here today as well. Any questions for the witness? Seeing none, appreciate your testimony.
Okay,
Thank you. Next in favor. We're going to limit testimony now to just 2 minutes, just trying to get through the remainder of testimony and the other bills.
Good morning, Madam Chairwoman, members of the committee. My name is Arnie C. A.C. Dienoff, State Public Advocate. And this is a great cause. I've run into people who have encountered a bite from a tick or a mosquito and have gotten Lyme disease. It is debilitating. It is hard to go through. I've heard some of these stories, and you heard some of the testimony today. It's clear that the Department of Public Health needs to take this issue seriously, that we need to find treatments, awareness, alternative treatments, prevention, support, and education. I like the fact that this creates a grant, research, studying, and mandates health coverage. This bill states that 20% of the funds shall be efforts in rural Missouri for education, awareness, treatment, and prevention. And I like the idea of researching and finding alternatives, because not all the time does routine medicine or common medicine work, but there's a lot of alternatives out there that we don't take for granted and we kind of brush off. And if something works and something is legitimate and something is providing care or relief to patients of Missouri, I think we should welcome it with open arms and look at its results and long-term benefits. For those reasons, I support SB 887. Thank you, Madam Chairwoman.
Thank you. Any questions for the witness? Seeing none, appreciate your testimony. All right, any others here to testify in favor?
Good morning. My name is Chris Dietz. I'm a Missouri resident from St. Charles County, Missouri, and a husband as well as a father to a 3-year-old son who was just diagnosed with Lyme disease this past year. I can't tell you how hard it is to hear these testimonies today from some of the people that have been most affected by this disease. Our personal story actually has a different dynamic because the person affected cannot articulate what is going on in his head. He cannot talk to doctors. He cannot testify here today, so I'm here on his behalf. His name is Henry. About a year ago, he was diagnosed with, I shouldn't say he was diagnosed, we actually discovered a targetoid rash or a bullseye rash on his chest. Immediately, my wife took him to his pediatrician, his primary caregiver, who wrote it off as a nasty bug bite, end quote. After that, he developed severe symptoms, the targetoid rash not going away for several weeks. We then dropped him off at our parents' house, my parents' house, to watch him for the night. We got a call in the middle of the night that he had collapsed. After running, he lost his energy, stopped in his tracks, and collapsed on the floor holding his head, screaming "owie" multiple times. And again, he cannot articulate this. So after rounds of taking him to the emergency room, hours of talking to different radiologists, neurologists, infectious disease specialists, practitioners, they had no answers for us. All we had was an IV and a hep lock in his arm, and the poking, the prodding, the scanning, 2 CT scans to his brain, which is still developing at a young age. Nobody could tell us what was going on. We thought we were losing our minds. We went to doctor after doctor after doctor in the St. Louis region that again told us over and over again that this was simply just
You have a few seconds to wrap up.
Okay. That this was nothing else. We did pursue treatment with Dr. Christ. Unfortunately, he passed away. But I just want to advocate how important this is that we get ahead of this issue. It is affecting Missourians. It is affecting young children that cannot advocate for themselves. I'm in strong support of SB 887. So thank you. Happy to address any questions.
Thank you, first of all, for coming and sharing your testimony and
Sure.
your experience, and we hope that your son Henry gets better soon. Thank you.
Thank you.
Any questions for this witness? Seeing none, thank you again for your testimony. Next, in favor? Any in opposition? You have 2 minutes, sir.
Thank you, Senator. Hampton Williams on behalf of the Missouri Insurance Coalition. Specifically, I'm testifying in opposition to the section affecting commercial carriers, which starts on page 5. The first half of the legislation deals with the development of an eradication fund. I think all that's laudable testing and trying to track the development of this disease and how it's affected Missouri. I certainly I have no issues with that. The concern specifically I have regards the mandates that this legislation would impose on commercial carriers. It has a very technical definition of medical necessity, post-treatment Lyme disease syndrome. I'm going to work with my members to figure out kind of what the status quo is for the marketplace for the commercial carriers. I'll work with the bill sponsor. I was heartened to hear his concern over making sure that we're not dealing with quacks with sugar pills. I appreciate that. That's certainly a concern that we have with respect to the implementation of this. Specific concerns on the existing language is the mandate for coverage for holistic supplements and therapies, the limitation of the use of prior authorization and testing, antibiotic therapy and herbal medicines, the restrictions on step therapy, the mandatory coverage of experimental tests, and then the data collection for commercial carriers. One thing I'll observe is that for the commercial market, we only represent about 30% of buyers. It's businesses and individuals who are in the marketplace. Obviously through Medicare, Medicaid, MoHealthNet, there are broader data pools that could be leveraged that could implement this before it's a mandatory cost on private carriers. And the other issue, it sounds to me like that we've heard repeatedly, are concerns over the ineptitude of testing in the marketplace. I've not researched that issue specifically. It sounds like that is a kind of a threshold concern with any of these patients as well, and obviously without a diagnosis, then as far as what insurance can or can't do, that's a real question. So I look forward to working with the sponsor on this legislation.
I think he'll participate as a good partner with you to try to alleviate some of those concerns. So any questions for the witness? Seeing none, appreciate your testimony. Anyone else here to testify against?
Madam Chair, I dream of the day when I can come in and support a bill in this committee. Shannon
do as well.
Shannon Cooper today, representing America's Health Insurance Plans, and follow up with Hampton. Many of the provisions of the bill we don't have a problem with, or we actually support. Alpha-Gal is real. There's no denying that whatsoever. What brings great concern to us is there's no FDA-approved treatment for this. Currently, the majority of plans do not prior authorize antibiotics that are given for this. The EpiPen medications, most of those are on a step therapy process to make sure that we're getting the right medication there. So look forward to working with the sponsor. I'm not here to say no way at all. This is a real disease. It affects thousands of people. It's increasing every day in our state. It's something to be concerned about. We just want to make sure that folks are getting the proper treatment, the right tests, and that people just aren't out here saying, hey, let's try this, let's try that. Somebody else is paying the bill, so there's really no harm in doing it. That's our concern. Be happy to answer any questions.
Are you watching anything at the federal level on some of the engagement?
I have not. We kind of puts me in a particularly odd position, but Nancy and I also represent the cattlemen and the timber industry, and we've had meetings with the Department of Health here just trying to track information for our members who are out in the woods day in and day out to see how prevalent it is in those industries, and if we're seeing an uptick amongst our members in that. So
you would at least find the informational portion of this, the educational piece.
Oh yeah, I think
helpful?
that's good for everybody. We should not be afraid of knowing what's going on out there. I don't know if anybody from the Department of Health is going to testify. I think there's a great deal involved when you have to track all these cases through the government, and I'm not an expert by any means on what the process is on every case that says, hey, Shannon Cooper's got alpha-gal. Somebody has to, I believe, come out and do a report, and I think that was what the issue was last session, was the manpower and the cost of the department to track all this and then turn the information over to the federal government. But again, we're happy to work with the sponsor. This is a real disease. I don't want anybody to think that I am one of these individuals that says, it's all in your mind. It's not happening. So
Appreciate it. Any questions for the witness? Seeing none? Appreciate
Thank
your
you.
testimony. Thank you. Anyone else here to testify in opposition? Going, gone. Anyone here to testify for informational purposes? All right, sir. You have 2 minutes.
Yep. Well, I'm just one individual that I was out in the hallway earlier for the speaking in favor of it, but I suffered from Lyme disease for a very long time, and I just encourage everyone here today to do whatever they can to bring awareness to this issue, and then also support for victims, and also encouragement towards alternative treatment for abetting this, because the pharmaceutical route, it isn't foolproof. It isn't airtight, because if you don't catch Lyme disease soon enough, actually, then some of the tests won't catch it publicly, but some of the alternative tests do. So that's what I had to say about that. But anything we can do to support sufferers of alpha-gal and then also Lyme disease, we should do. And I'm just one person from Missouri who has an opinion. Thank you for listening to my testimony.
I appreciate it. Would you?
My name is Ryan Hagedorn from
Thank
Stockton.
you. Awesome. Will you take a witness form and make sure you fill that out and leave it
Yes,
on the
ma'am.
desk so that we
Leave-
can
leave it here?
record your testimony? Yep, when you're
Thank
done.
you.
Thank you. Appreciate your testimony. Anyone else here for informational purposes? Senator, thank you for
Thank you all.
bringing this forward. Thanks.
Absolutely.
Appreciate it. That concludes our testimony for Senate Bill 887. We will now go into testimony for Senator Travis Fitzwater's bill. That is Senate Bill 967. Anyone here to testify? 960. There's a conflict here. It's Senate Bill 968. Can we get a show of hands of who's in here to testify on this bill? Okay. Who is here to testify in favor? Who's here to testify in opposition? Okay, thank you. We're going to go ahead and limit testimony to 2 minutes so that we can hopefully get through the bill. All right, Senator, when you're ready.
Thank you, Madam Chair. Travis Fitzwater, I represent the 10th Senate District, and bring before you Senate Bill 968. It's a PBM reform bill. I've carried a PBM reform bill the last several years, and I'll just start by saying it's really, I've got a really important person in the room, and I haven't even said hello to him yet, but Tim Mitchell's back here. Hey, Tim. He's been a friend for a long time, and he owns a pharmacy in your district, Madam Chair, that I know you're aware of. And on my birthday in 2011, a tornado tore through Joplin, and he was on the ground immediately helping people. I drove down the next day because I worked with pharmacists for most of my career, and watched him heroically provide for the needs of the people in his community in such an inspiring way. And this all kind of comes from that. That is kind of the genesis of this desire to fight for PBM reform, because these independent pharmacists who take on such a large community leadership role should be fought for. And it's a hard environment. You know, the market's going to go where the market's going to go, and there's some adaptation that in a free market people need to adapt to. But when they're really, really big guys and they're really, really small guys, and the little guys don't have any choice but to sign contracts that are put in front of them so that their business can hopefully survive the next year, it makes it anti-competitive. And when those same big guys get to steer patients to their own mail-order pharmacies and get to and tell patients in the network that a pharmacy may be involved in that they can't go get drugs at their local independent pharmacy because for some reason they're steering them to one of the insurance-owned pharmacies, it creates just real consternation with people that are on the ground building businesses in local communities. And it's really hard, and this isn't the perfect solution. We've met, Madam Chair, you and I have met hours and hours last year on some PBM reform. I think this is dialed back compared to last year. There'll certainly be some conversation and a consternation over the dispensing fee part. Medicaid right now does a cost of dispense study. They don't have a PBM managing their spend in the pharmacy. They've actually managed costs really well. Our current, now new director of that Medicaid division was the pharmacy director, is an incredibly intelligent person who built a Medicaid program that actually fights for patients and independent pharmacies. Every pharmacy who wants to participate can participate. They get the cost of acquisition plus a dispensing fee, which they've come to a little over $12. Which, if a state government program can do it and ensure that everybody's treated fairly, I think that in the market there's a path to figure out how do we do that here too. And so, there's a lot to this bill. I think there's a lot of testimony that's going to come. I won't belabor the point. This is a reform bill, I think, that still needs some work, and I'm happy to sit down with everybody and anybody on this. But it's something that, whether it's my bill or whether, Senator, it's your bill that we ride with, there's got to be a way to ensure that patients are being taken care of, and we're saving these independent pharmacies that are not because the market is leaving them, but because there's anti-competitive practices within their own contracting that they can't control. There's got to be a way to find a middle ground on that, and that's what I'm here for with this bill. I'm happy to talk about the specifics of the bill. I know there are a lot of people that can also go deeper on those details, but there are several provisions in there that I think answer some of those issues that I've brought up, and I'm happy to take questions.
Senator, I appreciate your passion on this issue. The man that you mentioned is also obviously lives in my district and has become a good friend of mine through the actions that you spoke. I mean, he's just very invested in the community, and so he is here today to testify. I'm grateful to have him here.
He's a comforting presence in the Capitol, I'll tell you that.
Yes,
He's been a friend
he
for a long
is.
time.
So I have got a meeting with the Lieutenant Governor for just a minute, so I'm going to turn the time over to our Assistant Chair, Vice Chair, and then I'll hustle back because this is an issue, obviously, you all know in the room that's a passion of mine as
Great.
well, but appreciate it. Thank you.
Thank you, Senator. Appreciate it very much. Any questions for the Senator? Yes, Senator Lewis.
Thanks. Good afternoon.
Hi, Senator.
Hi there. Good morning. It's not afternoon yet. Thanks for continuing to work on this. You read my mind. My question was around the dispensing fee. Like who pays for this?
So the plans pay for it. So right now, if you look at Medicaid, the government pays for that, and it doesn't have anti-competitive practices where you're saying some pharmacies can participate or not participate. The pharmacies that want to dispense for Medicaid can dispense in Medicaid, and they don't have all the hoops to jump through. So the plans will pay for the cost of medication based on whatever plan you're on.
Okay. And then that could be passed on to the individual.
Of course, yeah.
Yeah. And so just, as we talk about cost of living, increase costs with everything.
Yeah, no, and I don't mean to interrupt you, Senator. PBMs are being sued all over the country right now, including in Missouri, for the way that they manage costs. Jackson County right now is suing on insulin prices because PBMs have pushed the price up significantly. You have a bipartisan effort in Washington, D.C. to ensure that there's not this spread pricing that's out of control, and there's whole pharmacy benefit companies. Mark Cuban has his cost-plus drugs. So what we're trying to do is figure out how does the state do a cost-plus method that's good for everybody, that doesn't bump anybody out of the market, but allows for the cost to acquire to be covered, but also something a fee that would take care of administrative costs. That's similar to what we're doing here, that everybody understands and knows from some common denominators.
Okay. Yeah, I'm just saying, like, I'm very familiar with PBMs and definitely support reform and transparency, which we talked about for like 4 years or so now. With the cost of living, I just get concerned that, I don't want to increase costs
Yeah,
to
and
my
again,
constituents.
Medicaid's different. They get different pricing from the federal government because they're Medicaid, so they always get the lowest pricing just by regulation. But I would say that if PBMs being that involved in that business saved a ton of money, why isn't Medicaid doing that? Mm-hmm. And so I think it's a good indicator for a system that maybe we could shift a little bit. And I'm not saying we have to turn it on its head. I wish we could turn it on its head. I wish we had the fortitude to do that. But I think that the way we go forward is to make some of these changes that ensure that independent pharmacies can thrive and PBMs can still be involved in the process, and that we have good patient care. And patients don't have to be turned away to an independent pharmacy for costs.
Okay. Yep. Thank you, Senator.
Any other questions from the committee? Seeing none, we will now take testimony for those that are in favor. And please keep your testimony to 2 minutes. If you have not filled out a witness form, please do so and leave on the table.
Chair, members of the committee, Henry Otolomock with the Missouri Pharmacy Association to go on record as in support of Senator Fitzwater's bill. Mr. Chair, you said time's limited, so I'll be quick. So, as the senator said, the bill is limited as to what the scope entails this year. Last year, various conversations kind of led us down this path in truncating the bill to do really two large things. The first one is a cost. Senator Lewis, you mentioned the cost of living. What the bill is trying to do is say that pharmacies can no longer be reimbursed or paid below the cost of what they purchased that medication for. In the bill, it states NADAC and MAC, both of those. One of them is private information, one is public. NADAC is used under CMS, and I believe several transparent PBMs and other organizations are now using it. I think Montana, Iowa, Delaware are now using NADAC as a ceiling and or floor for what a pharmacy will be reimbursed for the cost of the medication, right? To at least figure out what am I going to be paid for this medication that I paid for, so you're not going underwater on the claims. It'll be stated that this formula is based off volume, but what isn't said is that you're not always going to meet those volume metrics. So you never know if you're going to be above or if you're going to be below or made whole at the end of the month. The other piece is what others may call any willing provider, but it is not. Actually, in the bill, it states that the pharmacies that can be utilized are those that agree to a contract with said insurer or said provider. The patient has to agree to it and the pharmacy has to agree to it. All it states is that a patient can no longer be mandated to use a certain PBM affiliated pharmacy. The aim isn't to say that, hey, look, they can't do business with you, but if a pharmacy is within 5 minutes or 5 miles of you, and that's the one you so want to use, you can't be retroactively penalized or penalize the patient either for using that pharmacy. As Senator Fitzwater said, there's a lot of work to do on this bill, so look forward to it.
Well, thank you, sir, very much for your testimony. Any questions for the witness from the committee? Seeing none, thank you so much. Next, in favor of Senate Bill 968. Good morning.
Before I begin, Senator, could I touch on that really quickly? So when you ask about cost of living and dispensing fees, I can tell you, my name's Anthony Deshay. I've got 2 pharmacies in Columbia and 1 in Holt Summit. My biggest issue with that is it's not, I don't think the argument is the cost of living going up, but if you compare my pharmacy in Columbia to a pharmacy who's owned by CVS less than 2 miles away, they get reimbursed $480 for something I get reimbursed $80. So the cost of living wouldn't be my argument so much as the transparency and let's have a free market where we all get paid the same. What is the reasoning? You know, the cost of insurance for each patient would be a lot lower if we had, you know, a benchmark where we all got paid the same on these drugs and a fair price. That's just quick.
I'm so sorry to interrupt you, but whenever you do give your presentation, would you mind turning your mic on? Just so we can
Absolutely,
give it
yeah.
in the broadcast. Everybody online can hear.
Perfect.
Cool.
Is this good?
Thank
Good.
you.
Yeah. If that, does that kind of answer your question? It's like, I look at it as not, you know, it's not a burden to the patient. If we fix the problem at hand, it's actually going to save us money across the board. And that the problem at hand is no one has answers. There's no transparency as to why they're getting reimbursed $480 when I'm getting $80. So, yeah, I'll make this quick. Again, I'm Anthony Deshay. Thank you for giving me the opportunity to be here today. I grew up right here in Jefferson City. I started working as a pharmacy technician at 16, and I saw the impacts of a local community pharmacy on the community. I now own 3 pharmacies here in mid-Missouri. My wife also grew up here. She's a nurse practitioner. My pharmacies are more than businesses. Every prescription I fill is a neighbor of mine. I have very good relationships with them. Without independent pharmacies, I think many of our neighbors would go without access to the vital medications they need to lead healthy and full lives. While my pharmacies have filled 60% more prescriptions over the last 3 years, we continue to lose money due to negative reimbursements. Pharmacy benefit managers, which were initially created to lower drug costs, are now largely in the hands of 3 massive health conglomerates. You know these as CVS, Cigna, and United Healthcare. These PBMs operate with little to no transparency, and evidence shows that they're increasing costs to the customers while squeezing out independent pharmacies by controlling an overwhelming majority of prescriptions. Then negotiating those said rebates back to line the pockets of their parent companies while forcing us to accept rates that don't even cover our costs. The consequences are devastating. In 2024, there were 312 independent pharmacies, 73 of them closed last year. When independent pharmacies go under, it disproportionately affects the poorest and sickest members of our communities. A smart businessman in my situation would sell to a corporate pharmacy who can then turn a healthy profit from the scripts that I'm losing on every day. My family would be safe, but what would about my neighbors? Will CVS and Express Scripts send a delivery driver to my neighbor's door after their only car breaks down and they have no way to get their child's asthma medication? Will then they negotiate a payment plan with the customer after they lose a job and need time to get back on their feet? I doubt so. Those are the people that will suffer when their prescriptions are treated as numbers on a spreadsheet and not people in our community. On behalf of everyone at risk, I urge you to take action that puts our neighbors' health over corporate greed.
Thank you very much. Oh, sir, just a second, just in case there's some questions for you.
Yeah,
Any
sorry.
questions from the committee for the witness? Okay, seeing none. Thank you very much. Next in favor.
Mr. Vice Chairman, members of the committee, Jacob Scott with the Missouri State Medical Association and the Missouri Association of Osteopathic Physicians and Surgeons. Wanted to go on record in support of these great bills. I'm just going to go ahead and testify to both because they're both going to be heard here. PBM reform is long overdue. Our main concern, with physicians is the fact that these PBMs get involved in making prescribing decisions. It affects the whole continuum of care, the healthcare team. Pharmacies, local pharmacies are a valuable part of the care team, and it's long overdue for us to do some reform because our interest is protecting patients over profits, and that's really my interest here, and I'm happy to answer any questions from the committee.
Well, thank you for your testimony. Any questions for the witness? Seeing none, thank you, sir, very much. Next, witness in favor.
Almost afternoon, so good morning still. Thank you for everything you guys do and the opportunity to speak with you. Tyler Woods, I'm from Kansas City, pharmacist by trade. I want to just give a little bit of context here in the support feature because every one of the pharmacies that's going to be behind this is also, in context, a business owner, oftentimes small business owner, even more so oftentimes rural areas. We understand this dynamic more from, yes, we understand the dispensing side, but we also understand the business side of it too. And all these decisions impact us as a business owner. Additionally, as we work towards some of the rural health transformation across this state and champion some of these initiatives, we have to have care in these areas. These bills will also improve that opportunity for us. So I'll just end with, if we want to see us be better, we need to be better. Thank you.
Thank you very much. Appreciate your testimony. Any questions for the witness? Seeing none, thank you, sir, very much. Appreciate it. Anyone else that wants to speak in favor? Thank you for that.
Good morning. My name is Laura Kingsley. I've been a pharmacist since 2007 and an independent pharmacy owner since 2009. I also serve as chair of the Mo Health Net Division Prior Authorization Committee and as a board member of the Missouri Pharmacy Association. I have a unique perspective, sit at the intersection of patient care and public policy. I see firsthand where the system works and where the system fails. I want to give a quick rundown of what we do in our pharmacies other than filling prescriptions. We run a medication synchronization program across 3 locations, managing medications for over 4,000 patients. We provide adherence packaging, allowing many patients, especially seniors and those with disabilities, to maintain their independence. Last year, one of our locations alone completed over 34,000 deliveries to patients. For most of our patients, this isn't a convenience, it's a necessity, and it can be a lifeline. We partner through voucher programs with mental health centers, substance abuse treatment centers, the Voluntary Action Center, and the City Health Department. We help patients lower costs by finding manufacturer assistance, navigating formularies, and identifying clinically appropriate, less expensive options. Just this morning, my pharmacy manager has sent me 3 texts about the amount of time they have spent with patients, navigating their deductibles, helping them figure out how they're going to manage those. We provide vaccinations, long-acting antipsychotics, and other injections. We have an on-staff nurse that provides mastectomy products and compression garment fittings. We employ 16 pharmacists across 3 locations. At one location, we often have 6 pharmacists in the building at one time. There's no phone tree at one of my locations in Ashland where you call, you talk to somebody. We are fast, we are friendly, we are a healthcare hub. We are deeply embedded in our community, we know our patients, and we take care of them. That sounds good, doesn't it? Sounds like a place where you'd want your parents, your children to get their medication, probably where you'd like to get yours too. But many Missourians don't get that choice. Many are forced by their plans. Sorry. I just am asking that you support policies that protect pharmacy choice for Part D and dual eligible patients, stop PBM steering and self-dealing, ensure fair, transparent reimbursement so pharmacies can keep their doors open.
Thank you so much for your testimony. Appreciate it. Any questions for the witness? Seeing none, thank you very much. You got up before I could tell you no.
Mr. Chairman, members of the committee, very briefly, Organ Schlammer on behalf of the Missouri Pharmacy Business Council will just go on record in support of the bill. I'll make it by your offices and talk a little bit more about this in depth. Thank you.
Sounds great. Thank you very much. Any questions for the witness? Darn it. Thank you. Any other testimony for in favor? Okay, you can come up after him or her or him or her or next or.
Really quick, Lisa Panett, Armorvine, and we just want to go in on support. We think that this is going to help the small pharmacies and their patients.
Thank you very much. Any questions for the witness? Seeing none, thank you very much.
Thank you very much, Mr. Vice Chairman, members of the committee. My name is Arnie C., AC Dinoff, State Public Advocate. I've supported this bill for a number of years through different sponsors, especially last year. It seems like with medical and pharmaceuticals, we need to start putting Missourians first over big corporations and making decisions in terms of dollars and cents. I feel that pharmaceuticals and the medical industry from big insurance is being nickeled and dimed in terms of small pharmaceutical companies and rural pharmaceuticals where there are no doctors in several counties connected. The only real connection to medicine may be a local pharmacist. In my opinion, these dedicated pharmacists are needed. We as Missouri do not want to lose their expertise, their community and family values, giving back to the community and giving expert medical advice and life-saving measures, in my opinion. These small pharmaceuticals fight for Missouri consumers and people who need a advocate or somebody in their corner, somebody to fight for them, somebody that knows about where coupons are or less or more advantage to get the biggest bang for their buck. All they're asking for is a livable reimbursement, not to be nickeled and dimed by big insurance companies. This is about fairness and sharing in the marketplace. They all have costs, these pharmaceutical companies, and these small family pharmaceutical establishments have costs, salaries, labors, insurance, liability, and they need to pay for a home for themselves. Our medical and insurance and pharmacists in Missouri is coming to be very clear that we have a messed up system that needs to be reformed and reinvented for all. Patient care needs and quality of medical prescriptions are needed. This has been the last month in my ongoing issue with pharmaceuticals is a big wake-up call and a big wake-up call for Missouri medicine. I ask that you pass SB 968. Thank you.
Thank you for your testimony. Appreciate it. Any questions for the witness? Seeing none, thank you very much. Were you in favor, sir?
Yes.
Yeah, come on up.
I'll be very brief. Larry McIntosh, St. Louis area. We have 6 retail stores, mostly under the name Pharmax Pharmacies. I've been in business 31 years, pharmacy ownership. I graduated from Mizzou. My Mizzou guys left already, I think. I suppressed the MIZ for those of you that don't care about Mizzou. But I was not going to testify on this bill. I was going to testify on the other bill. But since we're living at speed dating here, I felt obligated to come up and talk. Senator, you talked about cost of living, and that was one thing I got to come up and respond to. We have cost of living problems too. I have 90 employees. We have 6 stores, 90 employees. We care a lot about our employees. We care even more about our patients. Well, not even more. We care most about our employees. As you all know, minimum wage went up to $15 in Missouri. We didn't have that many below $15, but young people, drivers, et cetera, our cost of living, our cost of doing business went up. Common contracting with PBMs, and you really shouldn't call them PBMs anymore. They're integrated health systems that include a PBM. Integrated health system insurance companies have a 20% profit margin mandated by law. If they have more than that, they have to return that back to the purchaser of I'm the one that buys our insurance for our employees. And we have a decent plan, and we pay about 70% of their coverage cost for our managers, and our managers are free, basically. So we know what the cost of living goes up. We live it. And yet a common insurance contract, when you sign a 2-year contract, 1 year it's an unacceptable rate, plus, literally, I'm not kidding, 10 cents. 10 cents. Somebody talked about a $12 dispensing fee. 10 cents. 10 cents. The next year, they drop the cost of living about they drop the reimbursement by whatever common area a barometer you want to use for the measuring tool by another 25 basis points and lower the 10-cent fee to 5 cents. How stupid is that? We do not accept some of those contracts. I'm not supposed to name insurance companies, but the one that includes TRICARE, the federal program, it's not your problem, it's ours, but they signed a 10-year contract that's so far below cost, we chose to decline it. The Missouri employees, retirees system, we declined that business. We cannot even service the people we're paying their wages for because it's upside down by a ridiculous amount of money. We're better off without that business. So I'm highly in favor of this bill, and there's another one coming up. I'll be back for that one. I'll fill out a form for both of those at that time. So please look at the details. The cost of living affects all of us.
Yeah, thank you, sir, for your
I'll
testimony.
answer any questions.
I appreciate it. Any questions for the witness? Seeing none, thank you very much. That was in favor, but I think it's the last one, so now our position. Any other testimony in favor? Okay, we'll start with in opposition. If you're in opposition to this Senate bill? What? Except for anybody that was sitting on the back row. No, I'm just kidding. Yeah, 2 minutes. 2 minutes.
I knew I should have sat in the back. Mark Dalton with the Mid-America Carpenters Regional Council. Appreciate you guys listening today, just coming in opposition. Again, we are not, against, fair pharmacy reimbursements or transparency. We operate under a complete, transparent pass-through model. Our plan sees everything from acquisition costs to rebates, final costs, and actually our fund operates where we have a dashboard where every member can see that for every prescription that they have filled. So we are fully transparent. We do see we have a large benefit by directing our members to our special mail order facility for some of the high-end prescriptions. We wouldn't be able to cover them under our plan if we were not able to utilize our nationwide mail order facility. That part of the plan alone saves our Missouri coverage about $5 million a year. If we were not able to direct our members that, those specific pharmaceuticals have to come from our facility, we would not be able to cover those under our plan. I'm a trustee as well on our health and welfare fund, so my fiduciary responsibility is to the members on that. So we're trying to get the maximum amount of coverage for the lowest cost. I think there's several other things in the bill willing to discuss, but creating, you talk about the MAC and the NADAC pricing, and the bill stating that that reimbursement has to be at the higher of the two creates a pricing floor, which I think negatively impacts our PBM's ability to negotiate for those lower costs. Every penny that we can get back comes directly to our plan. That's not a, nobody's making a profit off it, so we just turn that right around to benefits for the members. So, appreciate your time.
Thank you. Thank you for your testimony. Any questions for the witness? Seeing none.
Thank you
So much. Next in opposition? Seeing none? No, just joking. You're on the back row also, sir. Come on up. Good to see you.
Thank you, Madam Chairman. It is so good to be back with all my friends. Phil Cristofanelli here on behalf of the Pharmaceutical Care Management Association. I will fill out my first witness form ever sitting at this table. So thank you for your time. I just want to, Senator, you brought up a very good point. Who pays the dispensing fee? And I have to disagree with my friend, Senator Fitzwater. It depends on the cost of the drug and the deductible of the patient. If you have even a $25 deductible, but you're buying a $2 drug, and now we have imposed, say, this $10 dispensing fee, that's not going to be paid for by the plan. That's going to be paid for by the patient. And if you've got 4 of those cheap generic drugs, you're looking at $40 new a month in fees. And so the numbers matter here, and I think we need to take a look at that. Additionally, we really need to think about this mandated price setting scheme, because what incentive does the pharmacy have to go out and find the lowest cost source for their product if the government steps in and says, no matter what you went out and paid for it, we're going to dispense you at cost? That we need to have a balance between the payor and the provider that incentivizes everyone to provide the lowest cost to clients. The other parts of the bill concern largely specialty drug and specialty pharmacy designations and any willing pharmacy. Those are pharmacy networks. It's ultimately the client's choice. You just heard from the Carpenters Union. They sat down with their PBM. They worked out a plan that worked for them, that designed their pharmacy network. We could have wrote them a plan that included every pharmacy in the world and didn't have any accreditations. It would have been more expensive, but now you're telling them they can't make that decision, that they have to let every pharmacy participate, and that we can't direct high-cost drugs to the pharmacies that are accredited to handle them properly. And so those are our concerns with the bill. We're happy to work with you and the bill sponsor. I know it's a very complicated and technical area of the law, but we want to be a resource for you, and I appreciate the opportunity to testify today.
Thank you. Any questions for the witness? All right, seeing none, appreciate it. Next in opposition. I'm just going to note he is also on the back row.
Yeah, we got the cheap seats today, so. Thank you, Mr. Chairwoman. Hampton Williams again for the Missouri Insurance Coalition. I won't go reiterate all the points that Mr. Cristofanelli just raised, but we've worked with your office, we worked with Senator Fitzwater last year and years before on trying to address the concerns that we've raised before. There are obvious price concerns with respect to the dispensing of pharmaceuticals. We understand that. Our members understand that, both on the health as well as the property side. I mean, what people have to pay for coverage, what those premiums are, matter to us. And programs, PBMs, mechanisms that exist to help drive down what those costs are critically important. We want to make sure that these companies have the tools necessary to be able to negotiate. Again, many of the issues that have been raised by the pharmacies that you've heard today have to do with negotiation skills or what they have. There are other organizations that exist, aren't in this bill, PSAOs, that serve as counterparties, that represent groups of these pharmacies in negotiations. And so, when we talk about this issue, I just ask that you consider kind of the entire environment of the dynamics between these companies. It is complicated. We appreciate all the time and attention that you've given to this, that Senator Fitzwater has given to this. It's a dynamic system, but right now, we still have data showing that this is producing savings for Missourians, and we're always sensitive to costs. I appreciate this committee's concern on making sure that ultimately the insured parties are not paying more and are trying to receive their care at an affordable rate. So I appreciate your concern on that issue.
I have one question. So where do you get the data when it's difficult to understand what the true costs are when there's not transparency?
Well, with respect to what the costs are versus, like how do you estimate what the impacts are?
I mean, you indicated that it's saving people money, but what are the indicators when we don't have transparency to know what the cost is of the prescription that's being funneled through the PBMs to those that are receiving the medication?
Well, there's a report which identified basically what the market prices are versus what prices are paid through PBMs. There was a report published back in July of last year. I'll be happy to submit to your office and this committee, which calculated kind of what that is, the impact for Missouri, as a subset of what the national numbers are. So it took, the utilization rates for Missourians and then applied that towards basically what the national figures are, based off of federal numbers.
So is it a broader national?
No, it is. It certainly is that.
So how do we know that without the transparency piece, how do we know that Missourians really are benefiting from the PBM program? Other than if just carve outs or?
Again, I believe that the basis of this report has to do with what like aggregate national spending has been, and so that's how they prepared that study.
And then also, so I appreciate that. I would like to get my hands on that
Yeah,
report if
absolutely.
you wouldn't mind, and we'll disseminate that amongst the committee members. And then also in regards to I would like to know what your thoughts are in relation to the report in 2014 and 2015 at the national level, talking about the PBMs and some concern that they had at the federal level with what was going on with PBMs. And would that not also translate down into what's happening to Missouri consumers of prescriptions and medications as far as price fixing and go ahead, I'll let you answer that question.
Well, I was going to say, I've not read the 2014 or 2015 reports. I have read, there was a FTC report that was published 2 years ago and then a supplemental last year. And I have read a few of those. And right now, the general allegations of those reports are currently in litigation. There's not been any determination as to whether or not the general allegations of price fixing or anything else has actually taken place. I will say that, for the litigation that has commenced with respect to this field, PBMs are not exclusive parties to any of these actions. Manufacturers are named parties, and those really, again, the prices that anyone are negotiating, those are the counterparties. It's the manufacturers that are setting prices, and that's the constant push and pull that PBMs are trying to help mitigate those costs down. So it's again, a dynamic field, but yeah.
And sorry, again, I appreciate that. Do you have any comments in regards to the Attorney General's lawsuit against PBMs?
Yeah, I won't go into the whole deal. I will say so Jeremiah Morgan's a good attorney, and I've had a chance to work with him a couple times. He taught my appellate writing class back when I was in law school. One thing that I found unique about the petition is that the third footnote in the petition defines a term for manufacturer's payments that it uses throughout the entire petition. And that definition is so broad so as to include not just payments that the PBM received, but also volume discounts to subsidiaries, affiliated entities, or group purchasing organizations.
So would that include PSAOs?
I don't believe, well, it would depend what the structure of the group would be, but my point is that they're defining the term manufacturer payment to a PBM to mean a discount that an organization that's hired the PBM would receive. And so that is a very novel definition of what a party is or what an action is. And again, the PBM market is promoting that's what they're doing. They're trying to drive volume discounts to their companies. And that's to the businesses and the consumers that are utilizing them. So the lawsuit, I think, is very unique, but I really, that footnote caught me because That is not the natural definition of what you would think, a manufacturer payment would be to a PBM when you're expanding it to the PBM and everyone they serve, and you're saying a payment's also a discount.
Very good. No, I appreciate that information, and we'll take that into consideration. Any questions for the witness? Seeing none, appreciate your time. Thank you. Anyone else here to testify in opposition to Senate Bill 967? 968, actually. Our expert witness.
Good afternoon, Madam Chair and members of the committee. Jared Hankinson, representing the Missouri Chamber of Commerce and Industry, here to testify in opposition to the bill. In short, the Missouri Chamber represents employers who we trust put their best foot forward in securing the lowest cost and best plans for the employees, their employees. We have concerns that some of the provisions in this legislation would result in increased cost for those employees. And with that, I'll thank you for your time.
Appreciate it. Any questions for the witness? Seeing none.
Thank you very much.
Senator Bratton.
So the chamber's wanting to have the capability for the lowest cost. Now, didn't the Missouri Chamber also come and support Medicaid expansion, which was a government takeover?
I am happy to do some due diligence. That's before my time at the Missouri Chamber. I definitely could do some background education. I'll circle back in your office and we can have that conversation if that's okay with you.
Yeah, thank you.
Okay, any other questions? Seeing none.
Thank you very
Appreciate your
much.
time. Thank you. Anyone else in opposition? Step right up, sir. We like to get you some exercise in this committee.
It's good for me. Keeps me young. Madam Chair, committee member Shannon Cooper today representing. That didn't last long, did it? Representing.
That was not me.
Yeah.
Sir,
Representing.
It might be a sign from
It could
the
be a
divine.
sign. Representing America's health insurance plans, we just want to go on record in opposition. We appreciate the patience of Senator Fitzwater. I feel like we've had a good working relationship with him as well as yourself through the last few years as we try and hammer this issue out. But at the end of the day, employers, large and small, cities, school districts, you choose unions, they use PBMs to help them manage their prescription drug costs. And I think one of the biggest fallacies of this argument is that all of these entities are just too dumb to know what's going on. I mean, these are sophisticated organizations trying to do the right thing by providing health care to their employees, and PBMs are a good partner of ours. So we will continue to work with all interested parties. And I would like to point out that yesterday, our friends in Washington, D.C. Have the understanding that there was quite a bit of reform, not only to PBMs, but hospital transparency and billing issues tucked into a 1,059-page appropriations bill that is supposed to be voted out by the end of this month. It'll be interesting to see what those provisions are, and I would hope as we move forward, we would make sure that we don't create a scenario here in the state where we have a set of federal rules that are just opposite or contrary to a set of state laws that make it very difficult for our members to know whose rules are we going to follow. So I hope we can keep a close eye on that. It's supposedly this has to be done by the end of the month or we'll face another government shutdown. So I'll keep you and the committee members informed on the process and how that bill proceeds.
Thank you, Mr. Cooper. So would you be okay with some transparency just to make sure that?
Yeah, I think transparency is good for everybody, and I think, again, one of these fallacies that employers don't have the right to know what's going on. The carpenters testified earlier. They know exactly what's going on. They know where those rebates are going. A lot of employers want the rebates back. A lot of them don't want the rebates. You keep the rebates, you just give me the lowest per month per member price, and these plans are tailored to suit the employers. So, but I don't think there's anything wrong with us saying, hey, show us what you got, show us what you're doing here. I think
honestly, it might benefit the PBMs to have transparency simply because it validates their existence, right? If they're negotiating those better benefits for citizens throughout the state, then they should be able to show that.
I think transparency throughout our entire healthcare system would probably be beneficial to everybody.
So you just heard, never mind.
Go ahead. I'm
Mr.
here all
Cooper
day.
testifying in favor of something in this hearing having to do with transparency. Thank you, sir.
I might get up here on another bill shortly and say nice things.
Senator Lewis, have a question?
Hi there, good afternoon.
Good afternoon.
So with these bills for 4+ years, 5 maybe, we've heard
6, 7,
well, I haven't
longer.
been here.
I think they
Yeah.
predate you, Senator.
I'm on my 6th year. Okay, so we've heard transparency, transparency, transparency. Sounds like you're in support of transparency. Do you have language around PBMs that you would support that is transparency?
I think we'd be happy to look at whatever's out there. Obviously, I'm representing the trade group that represents the health insurance companies. Some of them own a PBM, many of them do not, and contract with different PBMs. So we just have to see it, but I'm not afraid of that conversation at all. But I think if we're going to be transparent, we need to look at everybody in the healthcare system and make sure that we're all, showing our cards, so to speak, to see what we can do to try and manage these costs.
Yeah, I think because, I think we've heard consistently that people do support transparency for dating before my time here in this building.
Yes.
And I find it frustrating that what is the answer? There's been PBM reform in several states. How can we not come up with compromise language that helps people, year after year after year?
I don't disagree. I think at the end of the day, we want to try and, and I'm not going to sit here and say lower healthcare costs because I don't ever think we'll see that. But I sure think that there's a lot that could be done to manage these costs, to reduce the increase and make sure consumers know what they're getting and that their dollars are being spent the best way possible to have positive health outcomes.
Okay, thank you.
All right, thank you. Any other questions for the witness? Seeing none, appreciate your
Thank you.
time. Anyone else here to testify in opposition? Anyone here to testify for informational purposes? Going, gone. All right, that concludes. Any other comments, Senator?
Thank you.
All right, that concludes our hearing for Senate Bill 968, and we will begin with a hearing in regards to Senate Bill 984, and I'm going to turn the committee over to our Vice Chair.
On this next bill, Senate Bill 984, how many do we have in the room? I'm assuming quite a bit. That's in favor. Okay, and in opposition? Okay, thank you. Well, it's the back row, Senator, so it's, we'll just keep them back there.
All right,
Is that all right?
Appreciate it.
Whenever you're ready, Senator.
Thank you, Vice Chair and committee members. I really appreciate the opportunity to have time to talk about this important issue. Senate Bill 984 is a critical step forward in reining in pharmacy benefit managers in regards to transparency. A lot of things this bill will do, I'll just touch base on that, is it requires transparency in PBM pricing, reimbursement, and compensation. It provides disclosure to plan sponsors and to the state. It establishes a fiduciary duty regarding PBMs to act in the best interest of their clients as defined in law. It establishes reasonable and predictable PBM auditing perimeters for pharmacies, and it protects patients from abusive PBM practices. And so just due to our time constraints, I'm going to turn the time over to our witnesses so they can testify.
Okay, great. Thank you very much. Is there any questions for the senator? Thank you. First, testimony in favor.
Thank you, Senator, for sponsoring this bill. Jorgen Schlemer on behalf of the Missouri Pharmacy Business Council. I too, due to time, will keep my remarks few. So, we all know the price of drugs are going up, and what can you do about it? And I think what we've heard over the last several minutes is transparency. It has to be real transparency. The idea that a plan sponsor who pays for the prescription for their employees, or their employees not being able to go to the pharmacy who dispenses the drug that that plan sponsor's paying for, can't have open dialogue. How much did you get reimbursed by my plan? How much are you charging me? What are the co-pays? Where in commerce can the buyer not talk to the seller? Except here, we can't. We have got to impose a great deal of transparency. If you look at nearly every report that has come out on the driver of cost increases for prescriptions, there is one item that is in every report, and that is PBMs raise the price of drugs. And how do they do it? And they say it's their opaque nature, and this bill imposes transparency, a lack of accountability, and this bill imposes a fiduciary standard. Your banker, your attorney, your stockbroker, your accountant, all those folks have to represent your best interest first. When it comes to your prescription drugs, and we just heard from the PBM industry, we represent the best interest of our clients to get them the lowest cost drug and do the best thing for them. Great. Then let's hold them to that standard to make sure all the bad actor PBMs come in compliance with all the good acting PBMs, and that we have a true protection, because the fiduciary standard is a self-correcting measure that needs no further legislation by you all. You guys could pass a 500-page bill, right, and try to put all these different things in there. But instead, if you impose that standard, it will ensure that they absolutely have to follow the best interest of their client first. We've seen it with the Attorney General's office. We've seen it with the FTC. FTC said, hey, by the way, insulin prices aren't the only drug they're raising. They're raising other drugs, many other drugs by, and the quote was, thousands of %. The PBMs are increasing the price of drugs by thousands of %. And so I do believe that the Senator's bill on transparency and the fiduciary standard will begin to get at a lot of that, and we'll be able to get the people who are buying the plans, the employees, employers, and the employees actually get to see and negotiate better deals for what they're talking about. Auditing provisions in there. I know there's a lot of other people to talk about that. I'll let them talk about that. Please, thanks.
Thank you very much.
Yep.
Appreciate it.
Yeah.
Any questions for the witness? Seeing
Thank
none. Yep. See you. Next.
Hello, my name is Abe Funk. I am a pharmacist from Cape Girardeau, Missouri. I am exceptionally grateful this morning to hear that both Mr. Dalton and Mr. Cooper are in favor of transparency, and so I'm looking forward to their testimony in favor of our bill in just a few moments. So in March of this last year, we had to close a pharmacy that I owned in Gideon, Missouri. Gideon's a very small town, very rural, and about the poorest part of the state. We were unfortunately not able to make it. So my question is, who delivers health care to those people? Who takes a vaccine to their home at this point? Who gives them their flu shot? Who helps them? Malden is the next closest town to Gideon, and even Walgreens could not make it in Malden, and they closed. So we see continually a lack of health care in these small towns. So how does transparency help with that? The answer is the business can see the actual data. They get an itemized receipt of what they purchased. If I go to the grocery store, I get a receipt of what I purchased. If I buy health care, I should get a receipt of what I purchased. The receipt will show what the studies across the nation that are not sponsored by large PBMs show over and over again, and that is that PBMs consistently raise the price of drugs. The large PBMs also pay themselves more. Study after study shows that, and we would like the transparent data to also back that up. We note that United Healthcare owns one of the largest PBMs in the country, and they just paid $9 billion with a B dollars to AARP to co-brand. Where did that $9 billion come from? That $9 billion came from your constituents' pockets, from the employers in your district's pockets, so that they could have more money to have a big branding campaign. They were not looking to lower the cost of health care for the people that they take care of. So I would ask for your support of this bill. We just want to help take care of our patients. I went to school for a long time to help take care of our patients and work hard for that. The PBMs also work hard, but they work hard to make money for themselves.
Thank you very much for your testimony. I appreciate it. Any questions for the witness from the committee? Seeing none, thank you, sir, very much. Appreciate it.
Mr. Vice Chairman, members of the committee, Jacob Scott once again representing a lot of physicians in our state. I want to thank the sponsor for the bill. This is some overdue reform, and it's something that you could pass this session that would really help out patients and really put patients before profits. So,
great. Thank you so much for your testimony. Any questions from the committee? Thank you. Next in favor. Thank you all so much for staying within the time limit, or pretty close.
Good afternoon. I think we can say that now.
My name is Laurel Pickering. I'm the president and CEO of the Gateway Business Health Coalition, formerly the St. Louis Area Business Health Coalition. I'm here representing the perspective of employers who do pay those dispensing fees that we talked about. Almost 500,000 Missourians are represented by our organization. Employers are the primary purchasers of drug benefits for working Missourians and their families, and for most employers, it's the fastest growing part of their drug spend right now. We need PBMs, like Shannon said, but at times employers are increasingly concerned about transparency, the alignment of incentives, and whether the PBM economics always serve in the best interests of the plan sponsor. So from that perspective, we support SB984. It addresses themes that employers consistently raise, like transparency, fiduciary responsibility, and access to information, those receipts about how their dollars are being spent. First, on transparency, we are expected to manage our healthcare costs and have fiduciary responsibility, but the lack of clear visibility into financial arrangements embedded in the PBM contracts makes this very difficult. Fiduciary responsibility, SB984 raises the concept of PBMs acting in a fiduciary capacity with respect to the plans that they serve. From an employer standpoint, this reflects a broader shift in the expectations we have in the benefits landscape. Vendors making decisions on behalf of the plan do so in a way that prioritizes the interests of the plan and its participants. Access to plan sponsor data. Employers frequently express frustration with the limitations of their ability to obtain timely usable data to manage the plan. And the bill's focus on providing plan sponsors access to their own data reflects the reality that employers cannot effectively evaluate benefit performance or alternative models without it. Also want to touch briefly on the audit provisions. We support those. I do have comments on the former bill against some of those provisions because they will raise costs, as Mark spoke about, and others, and I can submit those separately to the committee. So in closing, employers share the legislature's interest in ensuring that prescription drug benefit systems function transparently, efficiency, and in a way that supports affordable access for all Missourians.
Thank you very much for your testimony. Appreciate it. Any questions for the witness from the committee? Seeing none, thank you very much.
Good afternoon. Appreciate being here. Mike Burns. I am a pharmacist and own pharmacies in Kansas and 12 here in Missouri. I wish I had time to go back and go through the whole history of where we started and how in the heck we got here, but I don't. All I know today is what we have with the PBMs is we have a monopoly. That's exactly what we have. It is not a free market system out there. It is a monopoly. They take advantage of that. They take advantage of that by steering business to their own pharmacies, increase cost, increase prices, and continue to put community pharmacies out of business. I'm going to tell you a personal story, so I hope I have time to share this with you because with all due respect to the gentlemen that are here representing the Chamber of Commerce and the unions, they think they're seeing the facts. They think they're seeing everything. They're not. A few years ago, I got told those three words: you have cancer. I met with my oncologist, and then I put my plan together for my radiation, my chemo, my IV, my oral medication. I go to my pharmacy to fill my prescriptions for capecitabine. I have it on my shelf. It's a generic. I'm contracted. At that time, my company was fully insured and had a PBM. I go to fill that prescription right there in my pharmacy. Rejected. Specialty pharmacy, mail order only. I thought, okay, I see where this is going. So I sent my prescription in. I did what they told me to do. And then I waited. And the reason they say that they need to send these to specialty pharmacies is because of the expense. They're high-cost medications. They're also much more complex medications that need closer monitoring and therapy by pharmacists. Not once did I get a phone call through my whole 6 month of therapy from that mail-order specialty pharmacy asking me how I'm doing. What's worse is once I started to get my EOBs, that's your explanation of benefits, telling me what my plan paid. I have all this documentation. I'm going to share this with you about what the results were of that prescription. I could have filled it at my pharmacy with reasonable dispensing fees of even $20. We're going to go crazy and say $20 a prescription. That whole therapy would have cost my plan $2,800. When it went to the specialty pharmacy, it increased to $15,000 it got billed to my plan. They billed $54,000. Oh, but they only allowed $15,000. Well, I sure appreciated that. What that did is it billed my plan an additional $12,000, which what that does is allows the insurance companies to come back and increase my premiums because guess what? My spend is higher. So you know what? Then I was furious, okay? Which, by the way, I was cleared of my cancer, but the biggest thing that I had to do is I realized I've got to get PBMs out of my business. I'm a business owner like everybody else, but I also get to see all the sides. So I cut the PBM out. I also went self-funded with stop loss. Guess what happened? And every year, my insurance rates were going up for my employees. We have about 500 employees, have about 200 on the plan. Every year, they were going up that 5, 10, 12%, which we've always been seeing. Once I cut the PBM out, by the way, I developed a network of pharmacies. I pay my pharmacies, and in the network, cost plus about $15. Well, guess what happened to my cost? And I'm going to give this over to you. For the last 5 years, my cost for my company, for my employees, has been flat. You tell me how in the world I was able to do that. Everybody else can do that, but they've got to have the guts and the knowledge and experience to know how to do that. Your brokers and the PBMs and the insurance companies are going to tell everybody, if you do that, your costs are going to go up, you're going to be at risk, don't do it. It's very scary. But this is a fact, this is a reality, this isn't hyperbole, this isn't the PBMs coming in and spinning the narrative, thank God I'm here because we need to control costs. I say, you know what, you have controlled costs very, very well. Putting billions of dollars in your pockets while you continue to drive independent pharmacies, community pharmacies out of business, and continue to drive up the cost of health care. Questions?
Yeah, thank you very much for your testimony. Appreciate it. Yes, Senator Lewis.
Good afternoon. Sorry you went through that, and thank you for sharing your personal stories. You've got a very unique perspective.
Very unique, yes.
I just had a question. I just want to make sure I heard correctly. So the chemo, the meds to treat your cancer, you had the capacity to dispense those exact medications, but you were forced to go elsewhere. Is
Right,
that
my therapy, which is very common with a lot of chemotherapy, some of them are going to be IV, but we have a lot of oral medications we can use. In this case, it was capecitabine, sitting right on my shelf at my pharmacy. Went and grabbed the bottle, went to fill it, and obviously I was under contract. My pharmacy was under contract to fill those prescriptions, but certain drugs, they deemed that one as, that particular PBM deemed that one to be specialty. So that's why they rejected it. Wouldn't allow me to fill it at my own pharmacy. But based on my cost and my dispensing fees, the total cost of that therapy, which I will provide to you, would have been $2,800. Now, I'm going to guess they probably buy a little bit better than Auburn Pharmacy does, but even at my cost of the drug, so let's not get caught up and we're not incentivized to buy the lowest cost drug. That's not what we're talking about here. We're talking about reasonable dispensing fees, we're talking about transparency, and quit steering patients to their own pharmacies where they actually raise cost instead of lower cost. But yes, it was right there in my pharmacy. I could have filled it every single month, but I had to send it into the specialty. And again, not once did I get a phone call from a pharmacist asking me how I was doing. Now, very unique. I was a patient. I'm a pharmacist, pharmacy owner, and in this case, the plan sponsor paying for all of the insurance. So again, the thing, another big takeaway here is not only what they did to my prescription, and I was able to see how they increased cost, but what I was able to do when, as the employer, I took control. I cut that PBM out. I put my own network together, paying pharmacies reasonably, not only Auburn pharmacies, there's other pharmacies in my network to take care of my employees. I pay them very fairly, and actually my costs now for the last 5 years have stayed flat.
Thank you.
Yep. Any other questions?
Any other questions for the witness? Yeah, Senator Bratton.
Kind of off the beaten path, but I hear of all these high cost prescriptions. Do prescribers get kickbacks for prescribing medication to patients?
The prescribers themselves, I wouldn't say get kickbacks for.
Or the hospital or healthcare facility, do they get kickbacks for things that are dispensed?
Well, you might be getting into 340B, which would be a whole nother afternoon conversation.
Yeah, I'm not opening that can, but I'm just wondering if there's incentive to prescribe.
Under certain circumstances, there are some healthcare entities that will benefit from prescribing and dispensing higher cost medications and lower cost medications, and actually the PBMs do that as well, because as we probably have been through, it's well established that the PBMs today get well over 50% kickback of the cost of medication. And think about, we are the only country in the world that has a PBM involved in the pharmacy benefit plan. Doesn't anyone in here find that odd? And that the other countries, which, Trump is all over about, hey, we want to pay what the other countries pay. Well, I don't believe that the manufacturers are just that benevolent to the other countries. The difference is they don't have a PBM in the middle taking 50 to 70% of the medication cost back as a kickback, so they can sell it. So they can sell it at a lower cost.
Okay. Thank you. I appreciate it.
Yep.
Well, thank you so very much. Appreciate
Okay.
it.
You bet. And I'll make sure and send some of these documents over, because I want you to see it.
Next in favor. Sure, come on up.
I was going to say, if you want to leave those documents up front here, sir, I'll make sure that they get distributed to the committee members. Cool. Thank you.
Begin when you're ready.
Is it a mic on? Okay. Tim Mitchell from Neosho, Missouri. It's actually Senator Carter's district. And we've talked a lot about all the things, and Mike is a friend of mine, and I've heard this story, and it's personal. But I tell you, one of the things that really hits me home whenever we start talking about transparency is we need to be able to service our patients in our districts or in our cities, in our communities where we live. Senator Fitzwater talked about the fact that I had the opportunity to respond to the Joplin tornado. And I tell you, I saw things that I'd never want anybody to have to see, and I wasn't on ground zero. I wouldn't have that opportunity if I didn't have the community pharmacy there. And I think it's important for us to be able to service our patients. And dealing with PBMs, the transparency, I'm glad to hear the opposition of some of the previous bills say they want transparency, because I think that's a very important part of this bill. There's a lot of other things that need to be brought to the surface, and the fact that we have seen a few lawsuits popping up now with the Attorney General. I saw this morning, I actually sent the Senator the most recent thing I saw in Springfield, Missouri. They're suing PBMs as well for insulin prices. And this is something we're going to learn more and more about. So I think it's very important that we support Senate Bill 984. I appreciate you giving me the opportunity to talk about this, and I'll be glad to answer any questions.
Thank you very much for your testimony. Any questions for the witness? Seeing none, thank you, sir, very much.
Thank you.
Good morning. I'm Pamela Lanier. I'm Director of Government Relations for Freeman Health System, also in the Senator's District, and we are very pleased that she's asked us for our thoughts on this. I'm going to introduce our Vice President of Retail Pharmacy Operations at Freeman, and he'll shine a light on the audit portion.
Okay, thank you very much.
Thank you.
Y'all are going to let me follow Tim Mitchell. Roland Truan, Director Retail Pharmacy Operations, Freeman Health System, Joplin, Missouri. Mr. Vice Chair, Committee, thank you for having me here today. I can amend a lot of what I was hoping I might be able to talk to you guys about today, because I have people like Tim Mitchell and a lot of other retail pharmacy owners in the room that can speak to you about the struggles of a small independent rural pharmacy and the struggles that they fight because of the PBMs and the interactions that they have with them. Uniquely, I think where maybe I can speak and shed a little bit of a different light is that having the backing of Freeman Health System affords my pharmacy some other opportunities that a lot of other pharmacies may not have. So what that looks like from my end is we have a staff of individuals, technicians, pharmacy technicians, that we keep employed 40 hours a week just for the dealings and the operations surrounding PBMs. Whether that's fighting the prior authorization process on the front end to provide patients with the life-saving medications or the medications that their providers want them to have. And then in turn on the backside of that, fighting from the audit perspective when those claims then come into question later down the road. The auditing process it can be a significant involvement in staff hours on a regular basis. From a month to month, regularly we see maybe 10 to 15 staff hours get pulled off the front line to deal with the PBM audits. If we run into a situation of an on-site audit, that staffing investment can easily jump over 50 hours. And so I think what's really important about the additions that Senator Carter wants to put on the bill is really holding the status quo where we're at. I don't think we're putting any undue expectations on the PBMs, but let's keep it. Let's not get this under 14 days as a heads up. Let's give the pharmacies the opportunities they need so that they can keep their frontline staff where they need to be, working to help patients get the medications that they've been prescribed.
Thank you, sir, for your testimony. I appreciate it. Senator Lewis, you have any questions? Thank you. Appreciate it. How many more do we have in favor? Okay. Next.
I'll make it brief. I
Thank you.
used my good speech on the first one. I did not speaking twice. What I could say is just a personal story. The other day, the news contacted me about this PBM stuff. I did a quick story with them. I think it was 2 or 3 minutes. Within 3 minutes of that news story airing locally, I had 3 people call my pharmacy and ask if we were closing. And I say that because, I joke about it, but it's also very serious. I've had a pharmacy in Holt Summit, which is 15 minutes from here, for 3 years now. In those 3 years, I've yet to make a single penny of profit. And our business is booming. I mean, we're doing extremely well. And that just goes to show with, like I said, with the value of what we bring to that community. I also told my wife the other day, we were having a conversation about this, and I said to her, if nothing gets past this session, I promise you that we'll sell and move on. And I say that because I love what I do, but I can't continue to do it at this level and not make money. And, that sounds terrible, but also I have to provide for my family. And, I hear a lot about transparency today, and that's like the buzzword of the day. And yesterday when I knew I was coming, I had my accountant just send me, and I don't like to talk about numbers, but I'm very open book, and I tell people that between my 3 stores, we did over $10 million in business last year. My net profit on those 3 stores was $30,000. So that just gives you an idea. And I run it as lean as, I would love to have any of you guys come to my pharmacies. I have 3 great pharmacies. I run as lean as I possibly can. I don't have any of the new systems, anything like that. And that's where I'm at. So just a quick heads up. I'm happy to be transparent. Everyone keeps telling it'll raise the cost of healthcare, but I've yet, in the last 2 years, everyone I've talked to, I said, please send me something to prove this. I don't know if they've submitted anything to you guys, but I've yet to see any paperwork to show where these costs of health will increase.
Well, thank you for your testimony, and it's not wrong or bad to say that you're in business to make money, so no need to apologize. So thank you very much. Senator Lewis, do you have any questions? It's just you and I. All right. Thank you, sir.
Thank you.
That's a song.
We're not going to do it, though.
Just you and I.
Hello, my name is Amy Mitchell. I am from Cuba, Missouri, and I am a pharmacy owner. But this story is it's personal, but it's also about a patient, and it's about access. So I have a patient who is 79 years old, on 18 different maintenance medications, taking care of this patient for a while. We have a program where we call our patients like this on a monthly basis, check in, how are you doing, any questions on your medications, have you been to the doctor, that type of thing. This patient looked forward to that phone call every month and would share changes in doctor's visits and things like that. And the patient could no longer use our pharmacy because the PBM forced this patient to use their pharmacy. And this patient called the pharmacist that he spoke with every day or every month and just said that he had been hospitalized because his medications did not arrive timely. And so he had some just disconnect in his medication regime. So this happened again. It happened the second time. And after that second time, he was in the hospital. He was put into nursing care. And then he later passed. And that was my father. And it was very heart-wrenching for me.
that I could not care for him, that his insurance that he had worked his whole entire life for a union, and he was forced to go to this mail order pharmacy. So that is the story I just wanted to share with you all today. So I am in
Well,
favor of this reform.
Thank you so much for your testimony, and I'm so sorry for your loss and for what actually happened here. So, but thank you very much. Senator Lewis, do you have any questions?
I just want to echo the chair's sentiments, and that's pretty special that you are able to call, your patients on, that's awesome.
Yeah, thank you very much.
Thank you again for
Okay.
your testimony. Appreciate
Thank you.
it. I think this is the last one in favor, correct?
There's a lot more. They just don't want to
Yeah, the back row's all in favor.
All right, they're done. Yeah.
So thank you again, and especially Senator Carter, thank you very much for helping a lot. I think this bill I'm highly in favor of this bill. I just had two things. The guys behind me told me not to come up here, but I can't stop myself. And they really know how that risky is. So two things that I really wanted to hammer home that are separate from what they said. About 3 years ago, we went to a National Pharmacy Convention, and we listened to one of those really numbers guys from D.C. And I'm like, well, what's he going to say? Can you believe it and all that? He got up there and talked about it. I saw him the next year, too. So he said that the PBMs demand 60% as a starting point of a new drug, a new brand, they're all brands, the new branded drug. The PBMs start out demanding, if you want to be included in our formulary, and I'm sure you all know what that is, 60% off the top. So the manufacturer wants to sell a drug for $400, they immediately have to inflate the cost to $1,000 to give the PBM the six. Are they negotiating for us? Well, hell yeah, they're negotiating for us, but they're causing the problem because of the way they're doing that. And there's nobody in the back of the room that can deny that. They can talk about, is it 50% or 60%, but this is what's going on, to the point where the manufacturers are looking for ways to bypass the PBMs, and you're starting to see that now at the national level. The other thing I wanted to talk about was transparency. 3 years ago, our bill failed, sadly, didn't even get very far along. 2 years ago, it failed. 3 years ago, after it failed that first time, I started calling people and going, what do we need to do to get something? Let's focus on transparency, which is the number one part of this bill. I don't know that anybody in the room can honestly look themselves in the mirror in the morning and say, I'm against transparency. What they're going to try to argue is, well, we don't want to tell you the secret sauce. We don't want to tell you this. Well, just tell the damn truth. I'm sorry. Excuse me. Just tell the truth, okay? So 2.5 years ago, I started calling attorneys. And I'm not afraid of attorneys. A lot of good friends that are attorneys. And they tell me when I called them, please give me about 30 seconds. Can I have it?
Yeah, go ahead.
So I called about 12 offices, and I made good notes. I don't know what I did with my notes. I finally got to 2 good attorneys that would talk about what they had, and one of them admitted to being in the room negotiating with the PBMs for unions. And they went in there, and the attorney said, we demanded transparency. And if we don't get transparency, we're going to move. And guess what the PBM said? Go ahead. What they didn't say is, we know nobody else is going to give it to you. And they have the oligopoly of the big three was way up there. Fortunately, their numbers are going down. The word is getting out, and the transparent PBMs, I'm familiar with one of them. I don't know if I can say the name or not, but that is starting to get some head. It takes a while to get a transparent PBM going. Me and some of my friends invested about over $1 million in a transparent PBM, and we failed miserably because we wouldn't do some of the things other people do. And the attorney said, we tried. And I said, well, what'd you do? He goes, well, none of the other PBMs would do it either. Well, now Smith RX is one of them. I'll name their name.
We're going to have to wrap this up, sir.
Okay.
I'm sorry. Yeah.
Thank you very much.
Is there any questions for the witness?
Thanks.
Seeing none. Thank you so much for your testimony.
Chair, members of the committee, Henry Otelemock with the Missouri Pharmacy Association. We promised Senator Carter will be up here, so we're in favor of the transparency, the audit piece, and we're looking forward to working with the senator on all of this and with all of you.
Thank you very much for your testimony. Any questions for the witness? Seeing none, thank you. Anybody else here in favor of Senate Bill? 984. Okay, in opposition, except if you're sitting in the back row. I'm going to have to put this on a bulletin board or somewhere.
I'm back. Phil Cristofanelli with the Pharmaceutical Care Management Association, trade association representing over 20 PBMs. We appreciate Senator Carter's interest in this issue. There seems to be an impression that we're going to vigorously oppose the transparency portions of this. I've been working with our members. I think that we can get there on the transparency stuff. We believe in a high level of transparency between the plan sponsor and the PBM, and so we look forward to working with her on the language on that. There are some other parts of this bill that are concerning, that go far beyond transparency. Fiduciary duty mandates come with real costs. They force our companies to obtain extreme amounts of liability insurance and open them up to additional litigation that otherwise would not occur under the good faith and fair dealing standard that we apply to business contracts throughout the entire American economy. And so we would really want to look at that fiduciary portion to be removed. Additionally, we're concerned with some of the changes to the definitions in here, because it implements the ERISA preemptions that protect self-funded plans from state regulation when they're operating across state lines. That's a very sensitive part of constitutional law, and we believe some of the definitional changes here could create some real problems for self-funded ERISA-protected plan sponsors, and so we'd like to work with the bill sponsor on that. When it comes to auditing, I think that there's some language that we can get to that will help the senator get this through, and I'm working with our members on that. We'll continue to work with Senator Carter on that as well. These audits exist for the purpose of protecting against waste, fraud, and abuse, so we don't want to take that away, but we do want to make the process smooth for all the parties involved. And so that is my testimony on this bill. We look forward to working with you all on it and happy to entertain any questions.
Well, thank you, sir. Appreciate it. Any questions? Yes, Senator Lewis.
Can you just, well, hello.
Welcome.
Welcome.
Yes.
Welcome back. Good to see you. Congrats on the new job.
Oh, thank you.
Yeah. So I just, I heard a lot of what you're, not in support of. Can you specifically tell me, is there anything in this bill as drafted that you're supportive?
So the transparency and auditing portions of the bill,
Okay.
There is language that we can get to on there that I think our members will be comfortable with. I represent 20 members, and so sometimes that's like herding cats, but we've been working through this, and I think that we have a consensus position in the auditing and transparency sections of this bill. Where you're going to get a lot of pushback is that fiduciary duty mandate and anything that would implicate ERISA plans.
Okay. Well, thank you. Appreciate it.
Thank you. Any other questions? Seeing none, thank you very much for your testimony. Appreciate it. Testimony in opposition to Senate Bill 984. We're going to limit this testimony to 5 seconds. And 10, 9, 8, 7.
And done. Thank you guys again. Mark Dalton with the Mid-America Carpenters Regional Council and the back row. Kind of borderline against informational on this. Again, we support transparency. We just do not want any unintended consequences to negatively impact our plan. Love to sit down and discuss a couple of the definitions. A new definition and elimination of healthcare provider definition, just some things that may get into some murky area when it comes to our ERISA preemptions. So some minor things, but again, I continue to be amazed by the amount of people that come and testify that are somehow experts on our plan. I appreciate that some of the previous witnesses were able to set up their own company's plans that best benefits their employees. That's all we're asking to do as well. We have full-time in-house administrators. We have third-party auditors and a board of trustees that's made up of union representatives and 50% contractors, so the business owners. And we set the plan up that is best for the members and the contractors. And the transparency piece, we support transparency. We do see every penny that comes in, every penny that goes out. Again, for witnesses to come up and say that we're not seeing the real numbers when they have no idea what we do see on our plan. Fully transparent. We see every penny that comes in, every penny that our plan pays, that our member pays, that we pay for the pharmaceuticals, and continually audit with third-party auditors as well to make sure we are seeing all the true numbers. So again, that's what we're asking for, is just to be able to set up our plan that works best for our members, just the way other witnesses set up their plan that's best for their employees.
So what I heard is that you support the language, but you want to work on some of it.
Thank
Close,
you very
yes.
much for your testimony.
Thank you.
I appreciate it. Senator Lewis has
Actually,
a question.
I was going to kind of ask the same thing. I want to make sure I'm understanding that you are going to be either informational or opposition.
There's been some Supreme Court cases that have brought into question the ERISA preemption when it comes to state legislation dealing with pharmacy benefit managers and union plans. Some of the definitions with, an addition of a covered person and then the elimination of a healthcare provider. Some of those we just want to make sure is not feeding the narrative that brings into question the ERISA preemptions on our plan, since we are, cover members in multi-states.
Okay, and I want to just make sure I'm not putting words into your mouth. You also said you're okay with transparency, like if the bill sponsor was able to work with you and maybe.
Yeah, we'd
some
love to
others.
work on that, and transparency is a huge factor for us. As I'm a trustee on our plan, so again, transparency is key. Love to discuss some of the things, because when we sit down with our PBM and we tell them we're demanding transparency to see every penny, they don't tell us to kick rocks like other people have previously stated. We demand, this is what we want, this is what we're demanding to see, and that's what we get. So yeah, we support those kind of activities on a plan.
Thank you.
Thank you. Any other questions from the committee? No, seeing none. Thank you very much.
Thank you.
Appreciate it. Anybody else here in opposition to Senate Bill 984?
Mr. Vice Chairman, Hampton Woods with the Missouri Insurance Coalition. Similar to the sentiments previously expressed, we're willing to work on some of the transparency issues, but I do just want to point out that this issue on transparency is one of the mechanisms, a negotiating tool that PBMs have with manufacturers or pharmacists on trying to identify what market prices are and to try to lower costs. And while I appreciate the concern with respect to transparency, it's got to be universal. Everybody's going to show the cards. We can't be the only ones completely exposing what our metrics are. It's got to apply to the other parties involved in this. PSAOs would be others, but I mean, there's other dynamics within that system. So we look forward to having further conversations about that. The fiduciary language, certainly a concern, and one that we'll continue to discuss. The term on how to identify auditing, right now the language identifies 25 prescriptions. There's by metrics you can identify kind of what prescriptions have a higher propensity of abuse. Back in 2024, 80% of the growth in retail prescriptions were GLP-1s. You can identify kind of the subset of what things you need to look at in audits. Happy to talk about kind of the metrics of what those would look like. Finally, there's a section on the end which has to do with DHSS Critical Access Care Program. It is drafted to be in Chapter 376, which is the commercial insurance chapter. DHSS is under Chapter 192, and I'm just generally curious kind of why that section for DHSS is stuck in the DCI's chapter. So with that, again, happy to work with the Senator and appreciate the patience that you've had on this issue last year. And it's a learning curve for everybody, but again, look forward to working with everybody.
Yeah, thank you for your testimony. Any questions for the witness? Thank you, sir. Appreciate it. How many more do we have here that's to testify? How many more? Just the one? And two. Okay. Yeah.
Good afternoon, Mr. Chair, members of the committee. Jared Hankinson, representing the Missouri Chamber of Commerce. I will be brief. We share in some of the ERISA preemption concerns and the fiduciary responsibility concerns that you've heard from previous witnesses. And I'll leave it at that. Look forward to engaging with the senator on future conversations to get this to a point where everyone feels good. So,
Well, thank you for your testimony. Thank you for keeping it brief. Any questions for the witness? Seeing none,
Thank you very much.
Next. This is in favor, by the way. He's not.
I'm in favor of my favorite senator. Shannon Cooper, again, representing America's health insurance plans. We just want to go on record in opposition to certain parts of the bill. I think those have been expressed well, the fiduciary responsibility, the audit provisions. While we supportive of some of the language, we want to make sure that we do have the opportunity to make sure that there's not bad actors, and if there are bad actors, we can remedy that problem. And again, you know, transparency is good for one, it should be good for all. Look forward to my 3 o'clock meeting with the senator to discuss this in further detail. With that, I'd be happy to answer any questions.
Everybody's invited.
Everybody's invited.
Yeah, come on in.
Is there cake?
Is it fresh or is it from yesterday?
Thank you for your testimony.
Day-old. Okay.
And
Day-old.
by the way, Senator Carter turned 37 this last Saturday. That's why we mentioned the cake. So, any questions for the witness? Seeing none, thank you very much.
Thank you.
If I can just say thank you to the committee members. This is something that we've worked really hard on together, and I really appreciate last year's initiative and the way that we collaborated, and hope to be able to do the same this year. Thanks.
Any other testimony in just for informational purposes? Seeing none, thank you. Motion to adjourn. Thank you. We are adjourned.
See you in a couple hours.
Oh, wait a minute. Wait a minute.
Great to handle.
She likes your PBM.